Hi, I'm Roy.
And I'm Katie. So what if we told you that in the next 6 minutes, we can give you the tools to talk to your voters about healthcare and win them over?
You know, Katie, it was just 8 years ago that the Foundation for Government Accountability set out to change the conversation about welfare and work in America. For years, conservatives had struggled to talk about welfare reform, and they ended up just voting no, or even worse, avoided the topic completely.
That's exactly right, Roy. And 8 years later, FGA has helped lawmakers across the country pass more than 200 new laws that gave millions of Americans the chance to get back to work and pursue their American dream. That's why we're so excited to talk to you today about our plans to help conservatives win on the healthcare issue.
Okay, Katie, are you ready?
I'm ready, Roy.
All right, first of all, we talked to your voters, more than 10,000 of them. And you know what? Even though we're in the middle of an economic crisis and a global pandemic, healthcare matters to voters. And healthcare is absolutely a winning issue. But here's what's important. You have to focus on voters' biggest healthcare fears.
So let's look at the survey results. Here's the bad news. When we talk to your voters, both online and in focus groups, we learned that conservatives are down 4 points to liberals when it comes to who voters trust on healthcare. And here's why. Americans believe liberals have a plan for healthcare. It's that simple. They don't know what the plan is, they just believe that liberals have one. Unfortunately, they aren't aware of a conservative plan or even if one exists.
Here's how you can fix that. Talk about 3 biggest fears that voters have around healthcare. If you tackle this issue head on, we have found that there's a swing of 7 to 9 points from left to right. And that was true across the board with liberals, independents, suburban women, Latinos, and African Americans. But you have to address these issues with the voters in mind.
So let's get into the biggest healthcare fears. But before we get into the details, I want you to remember one word: uncertainty. This fear of the unknown disrupts voters' ability to plan. It creates uncertainty for individuals, families, and businesses across the board. And as I'm sure you know, COVID-19 made that worse.
The number one thing that voters fear: surprise billing. Your voters fear being surprised by an unexpected healthcare bill. You know the feeling. A healthcare bill arrives in your mailbox, and more often than not, the numbers are a shock to you and to your wallet.
So fear number 2 is skyrocketing premiums. When incomes are flat and healthcare premiums increase, most Americans are forced to make household budget decisions that are rarely good. And there's a constant fear of the next increase.
And finally, number 3, being able to choose the best doctor for the job. Americans, even more now than before the pandemic, are afraid they won't be able to see the right doctor or right specialist when and where they need it and at a cost they can afford.
So let's unpack that first fear: opening up the mailbox to find an unexpected bill from the hospital. So what's interesting about this fear is that not knowing what stuff costs actually caused more anxiety than the size of the bill itself. So these days, virtually every medical bill is a surprise because patients have no way to get their costs up front. And this is an easy fix: more transparency.
And here's how you do that. Make healthcare providers give an upfront, real price estimate of the cost before the service is provided. That may sound simple, but it's not happening today. This simple fix would alleviate this fear of the unknown and allow patients to better plan and prioritize their healthcare needs. So the uncertainty here is the surprise, and the policy solution would fix that. And it just so happens 81% of all the voters support it.
Okay, let's dive into the second biggest fear: skyrocketing insurance premium costs. So Americans have experienced years of big premium increases. Health insurance premiums have nearly tripled since 2000.
The answer here: more choices. Give folks more options to help manage healthcare costs. Voters need to know about new options available to help cover the high out-of-pocket costs they face. And the good news is, there's a number of great things you can do to tackle this issue.
That's right, Roy. There's association health plans, health reimbursement arrangements, which are like 401ks for healthcare costs, and short-term plans. These all open up a whole new world of options for folks. One of our focus group participants put it the best, and I quote, "We can customize almost every other coverage we have. Why not our healthcare? And 71% of all voters agree with her. Again, the uncertainty here is no way to manage higher premiums. And the fix? You offer them options that work.
Okay, let's get to the voters' third biggest fear. Can I keep my doctor or pick the best one for the job? This is an issue that several folks from our focus groups actually said keeps them up at night. When you're worried about your health or the health of your kids, your parents, or your grandparents, your first thought should not be, can I use my doctor that I'm using now? Or is that specialist in network or out of network? Needless red tape has a stranglehold on healthcare. See, Americans believe that people should be able to see a local doctor regardless of whether they're in network or out of network. And a whopping 78% of all voters agree with that.
So Roy, here's the good news. A handful of states like Arizona and Maine have already led on patient-focused reforms that allow Americans to access lower-cost care closer to home. So the uncertainty here is access to the right doctor, and this fix gives patients more options while lowering costs.
That's it. That's the 1, 2, and 3 of winning over voters on healthcare in America in 2020. End the surprise bills and make healthcare providers disclose the costs beforehand. Get rid of the one-size-fits-all approach to healthcare and give folks more choices so they can regain control of rising healthcare premiums. End the red tape stranglehold on healthcare and let your voters worry about the best healthcare options instead of the arcane rules preventing you from seeing the doctor that you want to see.
And here's the best part. The Foundation for Government Accountability is here to help. Roy here calls this the healthcare two-step. Step 1, go to our website and you'll find everything you need to win the healthcare debate. And if you need more, go to step 2. Just call us. We can walk you through everything. It's that easy.